Making sure you keep the muscles in your low back soft while you stand is probably the best way to get rid of that pain. So often when people come to my clinic complaining of back pain while standing, it's because they stand in a way that keeps the muscles in their low back on the whole time they're standing. This leads to back compression, leads to muscle fatigue, often producing their pain. So what do I mean by back muscles soft versus hard or contracted versus soft? Let me show you. If you put your hands on your side, on your hips, and you slide your thumbs back towards your spine, and then if you come off just a little bit so your thumbs are on top of the muscles that run up and down the sides of your spine, and you want to be able to poke your thumbs in when you're standing. If you can poke your thumbs in and feel soft, that means your back muscles are off. If it feels hard, that means your back muscles are on. And so if you're standing in a way that it feels hard the whole time, that's going to lead to that back pain very often. So to get a bit of a better idea, put your thumbs on there again and then slowly lean forward. If your back muscles were soft while you were standing there, you'll notice that they become hard. If they were hard already, you won't notice any difference. But either way, when you're leaning forward, you'll notice that your thumbs get pushed out. Then when you stand back up, your thumbs can go back in, or you can poke in further. You lean forward, gets hard, you lean back, becomes soft. Let me show you from the side what I mean. So you lean forward, you don't have to lean forward very far. No. It will feel hard. You lean back, it feels soft. Forward, it feels hard. You lean back, it feels soft. So that's what I mean by soft versus hard back muscles. Here are the 4 tips I usually give to my patients to help them stand with their back muscles soft or turned off. Tip number 1 is make sure you're not leaning forward when you're standing, but rather you're standing tall. Tip number 2, don't stand with your chin jutted forward, but rather make sure your chin is pulled back. Tip number 3, don't stand with your shoulders rounded forward, but make sure they're pulled back. And tip number 4 is don't stand with your arms folded across your chest, but rather have your arms at your sides or behind your back. We can do that same experiment like we did earlier to see if your muscles are hard versus soft, doing these 4 different moves, and we'll see how it affects your back. So put your hands on your sides again. Bring your thumbs back towards the center. Come off onto those muscles and poke your thumbs in. Now, if you jut your chin forward, you'll notice that your back muscles come on. You pull your chin back, you'll feel them soft again. So forward, hard, back, soft. Do the same thing with your shoulders. Round your shoulders forward, it gets hard. Pull your shoulders back, it gets soft. Lean forward a little bit, it gets hard. Stand tall, it gets soft. And then if you fold your arms across your chest, the same thing will happen. The muscles will get hard. And then if you have them at your sides or clasped behind your back, they're soft. So next time your low back hurts while standing, check to see if the muscles in your low back are soft. If not, try one of those 4 tips to get rid of that pain while you stand.